we recommend that routine screening. So mammograms are really there for screening for breast cancer, and that's what their purpose is. We recommend that routine screening just start at the age of 40 in our low-risk female patients, and that happens yearly with a mammogram. So there's a few things that you can expect to happen in a mammogram. One, you will be asked to be undressed from the waist up, so I would recommend wearing something comfortable from the waist down. So instead of wearing a dress, you could wear a skirt or shorts or pants, whatever you're comfortable with, just knowing that your top half will be exposed. The other thing is that the way that mammograms are performed is with pressure on the breasts. And so if you are very sensitive, then I recommend taking like either Tylenol or ibuprofen prior to going in for your appointment for that mammogram that day. A lot of time, breasts can be very sensitive like the week before our periods or during our periods. So if you have an option to schedule your mammogram, I would probably do it when you are on your either third or fourth week of your cycle, just to reduce any breast tenderness that the mammogram might create. The other thing is that we recommend not wearing any deodorants or moisturizers because that can skew the image of the mammogram itself and make it difficult to achieve a good picture. So those are some things you can expect and some things you can do. If there's an area of concern on a screening mammogram, then usually at that appointment where you're having your mammogram, the technician and the radiologist will come and talk to you, and they might perform like additional imaging, whether that be a sono or even a biopsy in the area that might be concerning. But you're usually talked to at the time of your mammogram if that was going to occur. A lot of times now, the results of your mammogram will be published to your patient portal, so you'll be able to see it there. And then your healthcare provider who ordered your mammogram would also reach out to you and just go over the results of it. They probably give them about a week just to get back. A lot of times we see those results sooner than a week, but that's kind of a good rule of thumb. So when we talk about screening mammograms, those are in our low-risk patient population. So if you need what we call a diagnostic mammogram, that's when you're presenting with maybe pain in the breast or a physical lump in the breast. And so that mammogram doesn't have to wait until the age of 40. So you can do that at any point if you're having actual symptoms or concerns with the breast. The other reason that you might want to do a mammogram earlier than the age of 40 would be if you have a strong family history of cancer, and specifically breast cancer, other gynecological cancers. So given your risk factors, your doctor or your provider might recommend starting screening before the age of 40. I think it's kind of similar, like if you have pain or you feel a lump or a nodule, then we still recommend that men get mammogram because it's still breast tissue. If you have a family history of breast cancer in a male relative, then that's actually considered even more high risk. And so just let your doctor know about that. So one thing that I do recommend that my patients do are monthly breast exams, kind of around the same time of their cycle every month, because we know that the breast can change with hormones and throughout your cycle. Things that you're looking for are lumps or bumps that weren't there since the last time you checked. You're also looking for any abnormal discharge from the nipple or any skin changes on the breast itself, or ulcerations on the breast. And those are things that are abnormal and that we really want you to bring up to your healthcare provider to see if you would need a mammogram or not. When your mammogram comes back, if there's a spot that looks abnormal, then usually the next step is an ultrasound and a biopsy of it, actually. So they will biopsy the spot that looks abnormal, and then those cells will be sent to pathology, and we'll see how abnormal those cells are. Sometimes it might come back benign and just a cyst or a fibroadenoma in the breast, and that's just something for us to keep an eye out for. Sometimes it might come back more suspicious for cancer, and then it'll kind of differentiate like what type, and then we can usually treatment goes from there. Yeah, I think that the key is really early detection, and I think that's why we start by screening even before patients present with a problem. So ideally, you want to catch things even before they become big enough or concerning enough to cause pain or to cause a physical lump in the breast, and that I think that a lot of times, like, breast cancer is very treatable. I think with new advances, like, breast surgeons in the field are doing really amazing things. They're doing stuff where you would actually spare a lot of breast tissue and still, get rid of that cancer. And so I think that the earlier we can find out if something is abnormal, then I think the better prognosis a lot of patients have and the better outcome a lot of times. Yeah.